Okay, good afternoon, and we welcome everyone that is joining us today. Thank you to Sarah for helping us with the opening slides. And my name is Barbara Campbell. I'm the Executive Director of the Dalton Foundation and very privileged to help out with the Haiti Health Network. I'm going to introduce Marie-Claire Charles, who will be translating. So I'll let you go ahead and do that, Marie-Claire, while I get the slides up.
Bonjour tout le monde. Non, moi c'est Madame Barbara Campbell. Moi bien content pour me là avec nous matin dans webinaire ça qui c'est service orthopédique en Haïti. Moi vais commencer par partager quelques informations sur l'organisation sur Haiti Health Network avec the Dalton Foundation et nous remercier tous les panélistes qui étaient acceptés de rejoindre nous pour session ça. Et nous avons Sarah Capri avec nous, c'est lui-même qui pourra passer slide pour nous aujourd'hui.
All right, thank you, Marie-Claire. This one's not supposed to be scrolling. Hold on just one second. I'll go ahead and do it manually because this one's not supposed to be scrolling. But as people are joining in, I just wanted to share a little bit about the Haiti Health Network and some of the activities we have going on.
Et pendant que nous attendons plus de monde pour retrouver l'appel là, nous pourrons partager quelques informations sur Haiti Health Network.
What you're seeing right now is the Relink Global Health Database that categorizes and lists healthcare facilities throughout Haiti.
Page ça que nous regardons, c'est page d'accueil Relink Global Health qui c'est une base de données qui regroupe tout centre de santé, l'hôpital clinique à travers Haïti.
Our Haitian staff has done an incredible job gathering data and entering it into the database. I want to say thank you to Emanuela, who's on here, that helps us with that immensely, and Shalkovsky, who's not on today, but helps us a ton. But we hope this is a resource for you to identify resources in Haiti. If you did go under specialty services and go under orthopedics, you should see everybody here on the panel today or their facilities and a lot more. So we want to have that available to you. And then we also do print directories as well.
Nous remercions staff nous en Haïti, ils font un travail extraordinaire dans la collection de données. Et nous remercions Emmanuel Latou qui soit appelé là avec nous, il fait un travail extraordinaire dans la vérification de données. Et avec Kovski et Mab qui passe au appel là Kounia. Et nous partageons l'information pour toute population et nous créer un livret tout qui réunit toute information ça. Et j'ai un exemple, I have an example here. Ça c'est pour le département Nord-Ouest, nous créons pour chaque département.
Ah, perfect. Thank you. And we also have a Haiti Health Network website that we want to encourage you to join on and learn about the resources. We do post events there. We have ways for you to get involved with different groups. You'll see that we do have a specialty Facebook group for orthopedics. So we encourage people to use that for communication.
Et nous avons tout site Haiti Health Network là, côté nous avons un calendrier, nous poster tout événement, toute activité que nous gagnons pendant l'année ou bien pendant le mois. Et nous encourager l'autre monde si tu as quelques activités sur la santé que nous t'avons nous publier sur le calendrier ça pour nous avons fait ça avec plaisir. Et puis l'autre bagage que je pas te dit dans base de données information yo classé par type de service et nous si nous regarder nous ka tout le monde qui sous panel là jodi nous ka clinique côté au servi ou bien l'hôpital côté au travail ou bien et service personnel eux-mêmes.
Thank you. And we also host healthcare roundtable discussions every other Monday evening. And these have been a fabulous way to communicate during COVID and all of the instability in the country. And we welcome you all to join us. Our next one will be February 1st.
Et chaque deux lundis, nous gagnons un panel de discussion sur santé générale à travers Haïti et spécialement sur COVID-19. Nous encourageons tout le monde à participer. Prochain rendez-vous, c'est pour 1er février à 6h30.
All right, and I also just want to announce we have a couple other webinars coming up. On February 10th, we have a clinical lecture on dementia. And on February 11th, we will have a webinar on neonatology services in Haiti.
Et moi, t'ai aimé annoncer tout quelques autres activités nous gagnons cap vini pour mois février. 10 février, nous gagnons une présentation sur démence et 11 février, nous gagnons l'autre sur service néonatal en Haïti.
There's a little bit more about the dementia one.
Et ça, c'est plus d'informations sur le programme démence.
And lastly, I just want to mention that we are partnering with the Haiti Medical Education Project to help promote their clinical lecture series that they have for Haitian healthcare professionals. That's every Wednesday morning from 8 a.m. to 9 a.m. And if you're interested in getting involved with that, please let us know and we'll make sure you're on the invite list.
Et dernier bagay que moi t'ai mentionné, nous gagnons une formation qui fait chaque semaine, chaque mercredi par institution HME, côté que yo enseigné des médecins, infirmières, des gens qui travaillent dans la santé. Si nous t'avons plus d'informations sur ça, nous pouvons contacter nous, c'est chaque mercredi à 8 h dans le matin.
All right, and that's enough for announcements. Thank you all and welcome again to everybody. I'd like to turn it over to our great moderator and leader, founder of the Haiti Health Network, Dr. Ted Kaplan. Those of you that know him know he's been collaborating in Haiti for a long, long time. So thank you for moderating for us, Ted, and I will turn it over to you.
Et maintenant, moi, t'ai aimé passer place à Dr. Ted Kaplan, qui c'est fondateur Cap Haitian Health Network et cofondateur Haiti Health Network. C'est un monde qui travaille en pile pour l'institution et c'est lui-même qui est modérateur nous pour matin. Alors, Dr. Ted Kaplan.
Thank you. Thanks everybody for joining this morning. I want to pass on my apologies and regrets from Dr. Carroll, who was going to help us today. He is helping with the COVID care and says he's very overwhelmed in a very overwhelmed unit taking care of COVID patients and not able to join us today. But we know.
Merci à tout le monde qui est là avec nous. Moi, je présenter excuse pour Dr. John Carroll qui t'a supposé un modérateur ensemble avec nous, mais malheureusement, il n'est pas présent. Et c'est un plaisir pour nous là avec nous.
We know he's done a lot of great things and continues to do a lot of great things for Haiti, and we always enjoy when he can join us.
Nous connaissons que c'est un monde qui travaille en pile pour Haïti, qui fait un pile grand, qui accomplit un pile bagaille dans le pays, et nous sommes contents qu'il fait partie de l'équipe noire.
So today we're doing what we've done for several specialties already, which is try to help everyone learn more about what's available in Haiti in this specialty.
Et jeudi, nous avons partagé plus d'informations avec sur qui service qui gagne nos affaires orthopédie en Haïti.
This is something, of course, everybody practicing medicine wherever they are needs to be aware of specialty care, but it seems to be, given the challenges in Haiti, especially an issue that many people are not aware of what is available.
Et parfois, nous connaissons que c'est un problème, en pile fois, moun qui prestataire de santé, parfois, ils ont besoin d'informations. Si vous avez besoin de référer un moun pour un service spécial, des fois, vous n'avez pas toute information ça là, et c'est une raison qui fait nous gain genre d'activité ça pour partager information ça montrer qui ça qui gagne, qui service qui est accessible et comment pour nous accéder.
So I'm going to ask the participants we have today to help fill in the audience on what they have to offer, how they can access those services institutions.
Et nous prenons le panélistes chance pour yo présenter le travail que vous faites et comment que nous-mêmes nous pouvons accéder aux services et comment nous pouvons contacter et qui genre de service que vous avez.
A particular issue that comes up is that we hear about often in our networking activities is people have a serious case of any kind of serious case and are trying to figure out how they can get care in another country. And so I think in orthopedics, one of our questions for today is what, if anything, in this field needs to go to another country? What type of conditions, what are the limitations to orthopedic care in Haiti, and then any experiences our panelists have had in trying to arrange that, they can pass on to us. But I think this is one specialty where maybe there's not very many cases that need to go out of the country.
Et parfois, nous rencontrons des cas côté peut-être orthopédistes qui ici en Haïti ou capable gagner accès pour travailler sur lui et peut-être que nous sommes obligés de voir dans l'autre pays. Nous ne connaissons pas exactement qui genre d'informations qui gagnent sur ça et peut-être par les listes qui ont plus d'informations. Alors, nous connaissons que orthopédie c'est peut-être qui besoin en pile en Haïti et nous souhaitons toujours plus d'informations à travers panélistes.
So we were referred an example case from Sister Choi, who's in the Port-au-Prince area somewhere. Also, I noticed that she's a nurse practitioner, not only a sister. I don't know if she's on the panel today, but she provided this case that they've dealt with, which I think is a pretty good example of what many of us have experienced, especially if, like me, they come to visit sometimes and are doing mobile clinics or intermittent care, these types of serious and very sad cases.
Et
I think Marie-Claire might be, I don't know if it's me or her that's.
Marie-Claire, you're cutting out a little bit. Emanuela, are you able to translate a little bit?
Yes. Kwa tek nou gen yon exemple de yon cas typique de yon infirmière qui travaille dans Port-au-Prince qui c'est Miss Choi.
All right, Ted, do you want to share the?
And she gave us an example of some of the sad cases. Let's go back one slide, please. That I once was visiting in a rural part of Haiti, and they showed me a guy with a bone sticking out of his leg who fell out of a tree 25 years ago, didn't get any care. He functions with one of the major long bones of his leg sticking out of his body. So these are the kind of things that lack of care, or in many cases, lack of awareness of where to get care, keeps people from getting what would be basic needed care for serious injuries.
Ok. Yon nan ka sa ou, c'est un exemple de yon jeune garçon qui te gen yon fracture ouverte, kote zoa te sorti dehors. So, li pat jwen assez suffisamment soin pour te ka, li pat jwen assez soin comme si pour te capable réparer fracture ça qui te gen. So, ça te fait plus que 20 à 25 ans. Ça, c'est un triste cas que nous gagnons et c'est un exemple pour montrer comment situation soins de santé spécialement dans branche orthopédie en Haïti.
So this case here, there's a guy who's had this serious fracture and was found not only in bad shape with his injury, but also malnourished and very, very poor person without anybody to stay for him.
Emanuela, can you translate, or Marie Claire, are you
Also
back?
getting trouble. He was having trouble getting anybody that wanted to take care of him, and a person, without a voice, you could say.
Et patient sa te rive nan un moment kote que li pa te gen moun li te ka pale avec qui pou te pran soin.
So you can go to the next slide.
Okay,
Can I do it or not? Probably not.
I got it.
So here's his X-ray, 2 long bone fractures.
Et
Not
ça
very well on it.
c'est résultat radiographique qui ont été fait pour lui. Il y a 2 os qui étaient fracturés.
And we had some laboratories on the next slide. It's a little hard to see and read, but he has anemia to go along with his severe nutritional situation, maybe something to do with his injury also. And he has a little elevated white blood count. For some
Et en
reason.
plus de ça, nous avons dans liste d'analyse que il y a l'autre complication, l'autre problème qu'il a déjà gagné, en plus de fractures qu'il a fait.
So I don't think there's another slide with that, is there, Marlon? That's it.
No, there isn't.
So we're going to go ahead and turn this over to the panel who are going to tell us about the programs they work with, what they can do there, how they deal with these kinds of situations that are multifactorial, including social poverty in the extreme, and at what point we need, if any, the help of the help of care outside of Haiti for any of these conditions.
Et à partir de cas ça nous sommes étudiés, nous avons quelques problèmes qui présentés et avec panélistes que nous gagnons là, nous allons passer au place là pour présenter tête yo et puis présenter travail à faire et montrer nous comment genre de problèmes ça qui déjà existent dans le pays, comment ils ont affecté le travail qu'il a fait en Haïti.
So Dr. Nelson, we've known each other for quite a while through our mutual efforts to help in Haiti. He was one of the first specialists we worked with in the Cap-Haitian Health Network before the earthquake happened. And I remember it was the earthquake that essentially moved him from the Dominican Republic and Justinian Hospital to where he is now, where he's going to be telling you. And they were knee deep in dealing with the earthquake, which is a very amazingly admirable thing that they did. As everyone knows, that was to a great extent, an orthopedic disaster among all the other specialties. So turn it over to, after translation, to Scott.
Et Dr. Scott Nelson, c'est un orthopédiste qui est vivre en République dominicaine, mais avec le tremblement de terre qui était passé en Haïti en 2010, il était venu entrer en Haïti, travaille en Cap-Haïtien. C'est monde que moi reconnais très bien en parlant de Dr. Ted Kaplan, qui travaille en pile pour PIA et qui a fait un travail extraordinaire. Il a travaillé qu'on y a dans l'hôpital Adventiste d'Haïti.
Let me add one little bit about Scott that's important for everybody to know if they don't know, is that he is a subspecialty pediatric orthopedics. And the question of how to handle those cases is another one that we should answer today.
Et un bagay que m'a pas ajouté pour Dr. Scott Nelson, c'est un monde qui est spécialisé dans orthopédie pédiatre, c'est lui connaît comment pour gérer cas dans petit monde petit.
Thank you very much. It's a real privilege to be with all of you today and to present a little bit about our hospital. Ted, how long would you like to designate for each of these presentations? I know there's lots of subjects today. I was just going to give a 5-minute presentation of our hospital. Is that basically what you had in mind?
That's perfect.
Just a summary, and we'll be translating it, and then we want to have plenty of time for discussion.
Okay, well, yes, my thanks to all of you. Merci beaucoup à tout le monde. And you can go on to the next slide here. And then I will have Marie Claire translate. Haiti Adventist Hospital is owned by the Seventh-day Adventist Church, and it's part of a global healthcare system of more than a couple hundred hospitals, many of which are in North America. And at our hospital, our goal is to provide high quality healthcare to all classes of people.
Et l'hôpital que moi travaille là-dedans, l'hôpital Adventiste Haïti, c'est un hôpital qui fait partie de une institution globale qui gagne là-dedans plus que 200 l'autre hôpital, puis faut en retrouver en Amérique du Nord. Et mission l'hôpital là, c'est fournir service de qualité à la population.
So specifically, this is to provide accessibility to people who can't afford care elsewhere, and also to provide services that are attractive to people who do have resources and can go to other places.
Et premièrement, l'hôpital là offre accessibilité et soins à monde qui pas de moyens qui peut aller l'autre côté, monde qui pas gain accès à la santé vraiment, et nous offrir tout service à monde qui gain moyen et qui te ka trouver santé n'importe côté, qui ka trouver la caille nous tout.
We have an educational program at our hospital that we host residents and students from a variety of institutions, including the General Hospital downtown, as well as the Adventist University of Haiti, where there's a nursing school right next door to us.
Nous avons un programme d'éducation qui est très large, côté que nous avons un programme résidence pour l'autre étudiant tout. Nous travaillons avec l'Université Adventiste d'Haïti. Et when you said downtown, did you mean?
From HUAH and
avec l'hôpital d'État d'Haïti, Université d'État d'Haïti.
Yes, we also have international students, residents, and professors that come and serve at our hospital on a regular basis as well.
Et comme ça, tout régulièrement, nous avons des professeurs et des résidents qui sont dans l'autre pays, qui viennent enseigner et apprendre tout dans l'hôpital Adventiste d'Haïti.
Loma Linda University is a partner hospital of ours and serves as a educational hub of the Adventist healthcare system.
Et université, what was the name of the university?
Loma Linda University. It's printed there on the bottom of the slide.
Loma Linda Université, c'est une université partenaire avec Université Adventiste qui travaillent ensemble. Nous avons étudiants qui viennent pour apprendre ensemble dans le programme.
I'm sorry, we advanced. You could go back to the previous slide just for a moment.
Sorry.
Yeah, it's okay. I have a faculty appointment at Loma Linda University, still practice at Loma Linda intermittently, but I'm the medical director of the Haiti Adventist Hospital, and almost all of my time is spent full-time working in Haiti.
Bien que moi affilié à tous les deux universités, mais plus temps moi passé dans l'hôpital Adventiste d'Haïti, c'est là que moi travaille plus.
And we can go to the next slide. Orthopedic surgery happens to be one of the flagship services at Haiti Adventist Hospital. And this program, as Ted had mentioned, was started after the earthquake in 2010. And it's continued to be a constant presence and service and evolved and grown since that time.
Et un des plus gros services que nous offrons dans l'hôpital là, c'est service orthopédie, c'est chirurgie orthopédie que nous faisons. Et c'est un programme qui a commencé en 2010 et depuis ça, le programme a continué, il grandit et il a un pile service à travers la zone.
Dr. Francel Alexis, pictured on the picture on the left, is my partner there, and he's actually the chief of the orthopedic service.
Et nous avons une photo qui en haut à gauche, Dr.
Francel Alexis.
Francel Alexis, c'est partenaire moi, nous travaillons ensemble.
Yeah, lycée chef de service orthopédique. We do a variety of orthopedic procedures at our facility, including acute trauma and limb deformity, limb lengthening procedures, including bone transport, taking care of post-infectious issues, and other traumatic injuries.
Nous fait un pile gros opération dans l'hôpital là et Dr. Nelson, you might need to help me with some of those terms.
Yes, the déformation de les membres inférieurs, de supérieurs, allongement de les membres et soins pour infection aux os. We also do a number of pediatric orthopedic procedures, taking care of children with congenital deformities, as well as some other sophisticated procedures like arthroscopy. And most all procedures that we do in orthopedics here at in the University Hospital in California, we are able to do at the Adventist Hospital of Haiti.
Et nous fait un pile le travail avec Timon qui fait avec des formalités congénitales, nous travaillons pour eux tout et tout travail que à l'hôpital en Californie lui-même lui fait, nous avons capacité pour nous faire le tout ici dans l'hôpital Adventiste en Haïti.
We can go to the next slide. We have a very good rehabilitation service at our hospital.
Nous avons un bon programme de réhabilitation dans l'hôpital là.
Treating both inpatients and outpatients.
Et nous traitons patients qui sont hospitalisés et patients qui dehors.
This also includes a prosthetics program that was running for 5 years after the earthquake that is now being started again at our hospital.
Et nous avons un service de prothèse qui a commencé après tremblement de terre là, qui a travaillé pendant 5 ans. And you said it's still running?
Well, it's being restarted right now in partnership with Loma Linda University.
Et maintenant, on a rebalancé le programme ça ensemble avec une autre université.
And we have a very active program for the treatment of clubfoot that and our hospital has served as a administrative and educational hub for the national clubfoot program that's run at a number of centers around Haiti.
Et nous avons un programme spécial tout pour clubfoot. Clubfoot là, c'est les petits monde fait avec pied qui tordé. Nous avons un programme spécial avec une association qui corrige un programme ça.
We can go to the next slide. This is a boy named Tilus, and he's a 15-year-old boy from a mountainous area near Port-de-Paix.
Et jeune garçon ça, c'est un petit monde 15 ans qui fait en dehors de Port-de-Paix.
He suffers from something called Blount's disease, which is a growth deficiency on the medial side of the tibia, causing progressive bowing of the legs during growth.
Il fait une condition qui relève qui côté zo lui-même il grandit en façon qui est anormale. Yes, go ahead.
And he's one of the many patients that come to us without resources to have something like this taken care of, and a person that our team, the rehab team, combined with our surgical capabilities, is able to really make a life-changing difference for him.
Et c'est un patient qui vient mais qui n'a pas de moyens vraiment pour t'avoir payé le genre de service que tu as besoin pour soins qui sont nécessaires pour pied. Et nous avons possibilité, nous avons capacité pour nous faire le service là.
As many of you know, children like this oftentimes are marginalized, viewed as being cursed, many times can't even go to school. And these types of deformities are much more than just physical deformities.
Et parfois, nous connaissons dans la culture en Haïti, un pile de monde qui fait comme ça, yo passé une vie qui est très difficile, côté monde fait résibio, et parfois même l'école, yo capable aller, les ça maladie vient pas seulement physique, plus que physique.
We can go to the next slide. And I just wanted to share with you some of the other services that we also have at our hospital, and they include the following here in the list.
Et moi, je partager l'autre service que nous offrons dans l'hôpital là, et nous pouvons trouver dans la liste là.
At our hospital, I should also mention that we have a CT scanner. It's currently out of service, and we're working to get that program up and going again, as well as starting a intensive care unit.
Et nous gagnons l'autre programme spécialisé qui CT scanner qui pas marché dans le moment, mais nous travaillons pour nous rebalancer le programme ça qui est très important.
And we're also starting construction on soins intensifs at our hospital as well, which should allow us to take care of much more serious cases and improve the quality and scope of the services we offer.
Et nous avons élargi le programme que nous offrons et nous avons construit plus pour nous continuer à avoir un service de qualité et un service qui a besoin dans le pays.
And we can go to the last slide. Our emergency room is open 24 hours a day, and it's fairly well equipped by local standards.
Et salle d'urgence nous, li ouvri 24 heures sur 24 et li très bien équipé par rapport à standard local non.
And we do welcome you to visit our hospital in Carrefour, but hopefully you won't need to be coming to our emergency room on your first visit. We would welcome you to come for any of your needs, and we'll take great care of you. And hopefully you won't need any of our serious services.
Et nous invitons nous visiter l'hôpital noir. Nous souhaitons que ce n'est pas un moyen d'urgence que nous visitons, mais nous accueillons à deux bras pour nous voir quel genre de service nous avons.
And there's more information available about our hospital, the clinics, the services, the schedules, and other access to the services that we offer at our website.
Et nous gagnons plus d'informations sur le site nous, sur tout service que nous offrons dans l'hôpital là.
Thank you.
Merci.
Ted, we can turn it back over to you.
Thank you, Scott. Before I ask a question of my own, there was one from the chat about, I guess this is the rehab clinic at Hôpital Sainte-Croix. With the idea of joining into the network of clubfoot treatment centers, how could someone or could a facility do that?
Yeah, definitely. There's potential for that, and we have a director of the National Clubfoot program that has full-time office hours at our hospital, and we could definitely get you in touch with her. Probably I don't have her email at the top of my head. I can look for it, or if somebody could email me and I could forward it to her, but that would be the first place. This is a partnership with an organization called Hope Walks, which was previously run by Cure International, and certainly there would be consideration for that. One key factor with the clubfoot programs that are running is that there's sufficient volume to keep the attention to detail, the supply chain, and the training necessary to run those programs up to the standards that have been placed on that program.
Et tu as une question qui t'est posée sur le programme Club Foot là, qui était posée directement à Dr. Nelson, que te répond tout pour plus d'informations.
There's also a question about the best way to refer patients, especially those in need of acute emergent interventions.
So our emergency room is open 24 hours a day, like I said, and so anybody can be just sent to our emergency room without any preliminary warning. We're ready to receive patients as they arrive. If there's patients that need to be seen in the clinic, there's information about the clinic hours on our website, but those hours for the orthopedic clinic are from 8 o'clock to 2 o'clock on Monday, Wednesday, and Friday every week, except for holidays. And they can just come to our clinic without prior authorization.
Et l'autre question qui t'est posée, c'est comment, si tu as besoin de référer un patient pour une urgence, pour une intervention d'urgence, Dr. Nelson te répond que urgence là l'ouvrir 24 heures sur 24, il a toujours référé le patient à n'importe quelle heure et mes services le spécial pour orthopédie c'est lundi, mercredi. Would you please remind me of the schedule? Monday, Wednesday,
Yeah, Monday, Wednesday, and Friday.
and Friday à 8 heures.
Yeah, 8 to 2 o'clock.
Mardi, lundi, mercredi, vendredi, 8 heures pour 2 heures. Et puis, nous avons trouvé plus d'informations tous sur ce site-là.
So keeping to our general theme, you kind of answered it in your presentation, but I'm going to ask it again. You made a very bold statement about that you can handle anything that there that they can handle in Loma Linda University, which would mean, I guess, you don't need to send anybody to Loma Linda University. But is that really, there's no, I'm sure there's some rare procedures, but you know, I know there's several subspecialties in orthopedics and so forth, and equipment and so forth that make me wonder about you know, where the limit is.
Yeah, so there is a key word that I put in there, Ted, and that word was most.
Okay.
There are some things that the infrastructure of the country and of our hospital wouldn't permit, and that's mostly just for complex spine surgery. I try to avoid spine surgery as much as possible. There's issues with getting blood. We don't currently have our ICU available. I did a lot of spine surgery in the Dominican Republic as well as in the United States. And there are, I shouldn't necessarily be saying this in public, but there are certain exceptions that we make to that rule. And we do sometimes do cases on a limited basis when we are able to justify the risk-benefit ratio, but spine surgery is still something that should probably be referred outside of the country, at least for spinal deformity surgery. If it's a discectomy or something like that, then that's a different thing. We do total hip surgery intermittently at our hospital. Total knees we have not been doing at this point yet, and that's mostly an equipment issue. But general trauma procedures and pediatric orthopedics for sure can almost entirely be done at our hospital with the same quality and equipment that we use for these types of cases in the States.
And they're still doing the spine work in the Dominican Republic that they were before? Or is it?
No, I'm not involved in the Dominican Republic anymore. I have my hands more than full in Haiti, so I have had to.
Do they have someone there that's doing that work, or is that?
There are a few centers there. The Cure Hospital that I was working at full time there in the Dominican Republic actually closed 2 years ago, so that particular program's not going anymore.
Et l'autre commentaire que Dr. Kaplan t'a fait, c'était sur opération dans la colonne vertébrale et Dr. Nelson t'a montré comment que c'est une opération qui est difficile en pile et les structures en Haïti et structures dans l'hôpital là pas permettre genre de opération ça et parfois est obligé de référer à l'étranger en dehors du pays. Cependant, il fait opération dans le genou et il y a quelques cas dans 4 simon petit comme spécialité les permettre et les fait analyse pour voir qui risque qui danger qui a gagné ça qui arrive que vous fait le bouillon petit monde mais c'est pas un service que vous offrez.
We have one last question, I guess, and then there's another question which is sort of the same one from the panelists, and this is about supply chain issues, specialty orthopedic materials that are being used in other parts of the country. Are you able to collaborate on that with those facilities?
Yes, I am just reading this question here. So with others having some issues with in-country supply chain and orthopedic implants, the availability of implants in Haiti is extremely limited. Most of the implants that we use are from donations that have come from the United States. We do a lot of external fixation, which is a renewable resource. The actual implants that we use and do need to order on a regular basis oftentimes are sourced from India, which there's some variety and quality in the Indian implants, but there are some places that if proper research is done, they have very good quality implants and it's at a reasonable price. And so we're starting to source some implants through that pathway.
Et l'autre question qui était posée, c'était sous question implant, c'est implantation, Dr. Nelson?
Yes,
Implantation.
implant. So the plaque vis, fer, implant orthopedic.
Et ce programme, ça, il t'a demandé qui côté nous joindre matériel, nous joindre des outils pour le genre de travail ça. Et Dr. Nelson t'a expliqué comment que parfois vous trouvez des dons, vous gagnez un service, programme spécial côté vous trouver genre de matériel ça pour programme ça.
I definitely think that there's a possibility, an opportunity for collaboration amongst some of the different centers that offer orthopedic services to consolidate our implant sourcing. It's difficult to place orders for many institutions. It's difficult, the shipping costs, the customs costs, and if these orders can be placed in bulk and we collaborate together, I think that that would offer a lot of benefits, especially for some of the places that are functioning mostly on less of an international level.
Et parfois, il est très difficile pour nous faire genre de achat ça yo et nous faire partenariat avec quelques autres institutions dans la zone qui cap fait achat tout, laisse ça nous faire achat en gros, nous partager information pour nous connaître qui côté nous ka trouver yo qui plus bénéfique et c'est comme ça dans collaboration nous trouver genre de matériel ça.
And I'm going to ask Vilbert in the chat, the participants saying something about implants locally. Do you have availability of implants locally? Please, you can answer on the chat, and then we'll move on to our next speaker, Dr. Brown, who is working at Hôpital Sacré-Cœur in Milo in the north. And he's going to tell us about what they have to offer there in orthopedics. And you have some of his information on the slide.
Et maintenant, on a fait place à l'autre panéliste, nous, Dr. Theodore Brown, qui va nous présenter tête et ensuite parler nous de qui travaille la Femilo et qui service qui est disponible.
I can't hear it too well so far.
Nous partons très bien sur café si approcher plus à micro ou bien ordinateur ou bien parler plus fort.
Donc, merci, Marcel pour ce panel-là, pour une partie de nous en ligne. Et ma bonne une invitation que fait le là et moi-même en particulier. Donc, c'est Dr. Theodore Brown, c'est chef orthopédique de l'hôpital avec Milo. Donc, pour parcours médical même, dans l'université CCA, c'est le gardien de 2010, et puis fait un pénal social en 2012. Et moi, c'est une expérience de 2014-2018. Donc, depuis 2018, nous commençons avec pratique orthopédique. Nous commençons dans l'hôpital Waname, et puis après, nous sommes dans l'hôpital Milo.
Can you hear him, Marie-Claire?
Yes, a little bit. Dr. Theodore Brown, you can read his biography and the slide. I couldn't hear very well, but Dr. Brown is the chief orthopedic in Hôpital Sacré-Cœur de Milo in the north of Haiti.
That's what he was saying?
Yes, and saying his what's written in the slide where he worked in Waname before starting at Hôpital Sacré-Cœur de Milo.
Is he related to Dr. Theodore?
Dr. Brown, est-ce que vous connaissez Dr. Theodore?
He's my uncle.
Comment?
C'est mon oncle, my uncle.
Oh, yeah, it's his uncle. Oui, Dr. Theodore, okay, continue. Dr. Kaplan, did you get that? He says Dr. Theodore that you asked about is his uncle.
Yes, I heard.
Oui, et il travaille dans l'hôpital Milo. comme orthopédie.
Et Dr. Brown, attendez bien, non?
Ok, vous savez mieux qu'on y a?
Un petit peu.
Et donc, nous travaillons dans l'hôpital Pillon en tout. L'hôpital est bien présent de Pillon, donc, mais c'est Milo qui staff. Donc, Milo comme chef de service orthopédique, Milo. Donc, c'est l'hôpital qui est trouvé dans la région de pays. Donc, nous couvrons tout le département nord-est et même nord-ouest parce que nous sommes un peu malades aussi pour des faits. Donc, nous avons un service orthopédique qui est là dans le centre physiothérapie. Nous avons un centre orthoprothèse. Nous avons encore une salle plate. Donc, nous avons une salle d'opération, nous avons 4 salles d'opération qui nous opérons pour les 4. Nous avons une salle qui est propre à nous-mêmes, qui est ici à Mladani, matériel orthopédique. Et puis, nous avons encore nous avons deux médecins qui travaillent alternés, 2 semaines alternées. Nous faisons cas, nous faisons clavicule, nous faisons bras, nous faisons avant-bras, nous faisons coude, nous faisons poignet, nous faisons main, nous faisons tout hanche, fémur, nous faisons jambes, nous faisons pied. Donc, pour clavicule, nous faisons embauchage, la glissée, tout ça. Pour aimer aussi, nous faisons plaque glissée, puis nous faisons seulement ça, nous va faire dans l'hôpital là, nous va faire colonne, comme nous faisons tout à l'heure, nous va faire colonne. Mais nous faisons tout ça, nous faisons tout ça orthopédie, à part les colonnes et puis peut-être tout à l'heure, je nous va faire. Mais nous avons matériel pour faire peut-être tout à l'heure, que nous allons faire dans les prochains jours. Et puis nous coiffer avec de l'hôpital au New Jersey. Et puis nous avons patron orthopédie, qui est Dr. Lovejoy, et fils.
Dr. Theodore, one minute pour me get en traduire en partie dans ce dia. So Dr. Theodore also works in Hôpital in Pillon and also in the north of Haiti, but his work covers the north, the northeast, and the northwest of Haiti. They are 2 orthopedics who switch, and they do everything except for spine and also hips that they are working on starting soon. Vous pouvez continuer, Dr. Theodore, ou sous mute, ou sous silence.
Dans l'hôpital, nous faisons un peu l'opération, nous faisons membre supérieur, nous faisons membre inférieur tout. Donc, nous faisons un peu cas de parties ouvertes, nous recevons un peu d'urgence. Donc, sur l'hôpital qui a 4 salles d'opération, nous avons encore 11 belles salles, une grande salle de thérapie. Nous avons un service orthoprothèse et tout. Nous avons une salle plate. Donc, plus j'ai urgence et puis une externe. Donc, nous coiffons par l'hôpital au New Jersey et nous avons supporté nos Dr. Lovejoy, père et fils.
Hôpital Sacré-Cœur de Milo receives a lot of emergency and for orthopedics, and they have physiotherapy, physical therapy, and a lot of surgery and trauma. And this work is also done in partnership with a hospital in New Jersey.
Holy Name Hospital.
Holy Name Hospital in New Jersey.
Donc, nous parlons tout par Dr. Lovejoy, père et fils, qui supportent nous un peu dans le matériel, dans toute structure que nous avons ici dans l'hôpital Milo.
There are other foreign institutions. Come on.
Dr. Lovejoy, père et fils.
And Dr. Lovejoy, who also helps in finding materials for the program.
Donc, dans l'hôpital Sacré-Cœur de Milo, nous faisons un peu l'opération pour nous avons un programme qui nous avons fait parler. Nous avons un peu le programme, nous faisons un peu l'opération. Donc, nous allons faire colonne et puis nous allons faire prothèse totale genou. Mais nous faisons hémiatoplastie, ça veut dire prothèse hanche. Nous faisons toute partie diaphyse, toute diaphyse, nous opérons toute diaphyse. Donc, et puis nous faisons clavicule, nous faisons pied, nous faisons des opérations, urgences, et nous fixateurs externes, external fixateurs. Nous faisons tout service là, tout que nous mettons pour le monde qui parle mériter opération.
And they also offer the prosthesis for both legs and arms, also plates. And since Milo is a reference hospital in the north, as we said, it covers the entire region, north, northwest, and northeast. Dr. Kaplan, did you have questions for Dr. Theodore?
There was one from Dr. Mazur, which was similar to mine. I think you just said about the prosthetic. Is that what you're trying to say?
Yes, nous avons dit nous fait prothèse, Dr. Theodore, je suis confirmé?
Oui, nous faisons prothèse.
Yes, that's correct.
Prothèse hanche. Nous faisons hémiatoplastie. Nous faisons prothèse totale. Bien prothèse totale, acétabulum. Donc, nous faisons hémiatoplastie. Donc, nous faisons prothèse hanche, mais pas totale. Donc, nous devons faire totale. Bon, nous devons faire prothèse totale là. Nous avons fait ça dans 1 année, absolument matériel. Justement, qui ont un matériel, une pièce qui m'a fait pour faire prothèse totale hanche.
Would you put it totale? Yes, they do prosthetics, and also, as he mentioned before, they have one piece of material missing for the hips prosthetics.
And how about club? Do they still have the clubfoot program, Ponseti or otherwise going on there?
Okay.
Can you hear me?
Now we can. We had a break where we couldn't, Marie-Claire, but now we can.
Oh, okay. I didn't hear what Dr. Theodore was saying. Oui, Dr. Theodore, vous avez des questions? Est-ce que gagne un service pour club foot? Dr. Nelson?
Pied foot is what someone said it should be translated.
Okay.
Moi, c'est traduit en pied beau en Haïti, pied beau.
Nous avons service ça. Nous faisons chaque lundi, every Monday. Donc, nous faisons des plats à répétition. Nous mettons votre petit menu chaque lundi. Et là, on mérite votre vidéo. Nous faisons nous avons un programme qui est bon dans l'hôpital. Et chaque lundi, every Monday.
Yes, we have the club food program, and it's every Monday.
Yes.
So, merci en pile, Dr. Theodore. We so happy that you are doing this service in the north.
Thank you. Merci en pile.
And let's move on to our next speaker. It's Dr. Woolley, right?
Yes.
Hello, how are you?
Hello.
Hello,
Good
thank you
morning.
very much. Thank you very much, Dr. Calvin, for the invitation. My name is Dr. Woolley. I'm an orthopedic trauma surgeon based in Port-au-Prince, Haiti. I am a faculty at the La Paix University Hospital, State University Hospital residency program. And I'll be probably pretty much talking about that. And I'm also a traumatologist in private practice in Port-au-Prince. In terms of today, I will be talking about my role as academic director at the La Paix University program. So there are three, it's a state-run hospital. So La Paix is part of the two main residency programs in Port-au-Prince. HUH that Dr. Nelson mentioned is one of them, and La Paix HUP is the second one. And in the north of Haiti, there is HUG, which is also Justinien Hospital, which is also the third residency program.
Can you
our residency program
and translate every so often for those that on the call that don't understand English.
Je suis orthopédiste traumatologue. Moi, c'est un traumatologiste de formation. Moi, travaille dans l'hôpital universitaire de la paix, côté moi, c'est médecin de service et responsable de formation résident en orthopédie Kounia. Et nous, c'est l'hôpital d'État. Et donc, nous faisons partie de 3 programmes de résidence qui est en Haïti, qui c'est l'hôpital général, HUH, l'hôpital de la paix, HUP, et puis l'hôpital Justinien dans le Nord, qui c'est HUJ. All right, so in English now. So as I was saying, our program is so our hospital is a university hospital. Therefore, it's a 24-hour run hospital where residents are there and attending physicians. As Haiti is a very difficult country, I think our limitations in terms of implants and resources are very limited. Although we do now a good amount of cases going from mostly trauma, some pediatrics, some upper extremity, and joint replacements, not total hips, hemiarthroplasties, and no spine surgery and no complex pediatric or no total hips or total knees. Donc, nous faisons différents types d'opérations dans l'hôpital de la paix. Nous faisons opérations surtout dans la traumatologie. Nous faisons chirurgie et prothèse, et simple, prothèse hémiarthroplastie. Et puis, nous faisons tout l'autre type de chirurgie en rapport avec des cas de pédiatrie, des cas de membres supérieurs. Mais nous pas fait chirurgie de la colonne, nous pas fait chirurgie et prothèse totale de genou, et nous pas fait prothèse totale de hanche. Yeah, so in terms of our residency program, we have about 16 residents in training. Not all of them are in hospital. We have rotation hospitals in many places now, including Hôpital Lumière, where Dr. Oda will be speaking after me, will be speaking. We have residents rotating there. We have residents at Mille Ballet Hospital, which is a Partners in Health system. We have residents at Meuse now, and we're opening more and more residency rotations for our trainees at different levels. In terms of cases that we've been doing, we do mostly trauma. We now are doing pelvic and acetabular surgery. We now are doing more complex stuff, such as reconstructions and limb deformities, but we're very early on into the subspecialty cases, and we do not do any complex spine or anything that has to do with complex pediatrics. We usually refer them to our partners, including Dr. Nelson and Dr. Alexi at Adventist. And so that's pretty much my introduction. I'll give that in Creole, and I'm open for questions if need be. Donc, comme je dis, on fait beaucoup de cas de traumatologie à la paix. Nous faisons un pile cas et chirurgie Kounia, nous faisons chirurgie bassin, nous faisons chirurgie hanche. Nous faisons un pile cas de reconstruction. Nous pas fait chirurgie colonne, j'aime dire, nous pas fait chirurgie et genou, prothèse totale de genou. Mais nous avons commencé Kounia dans sous-spécialité. Et nous ouverts à questions. If there are any questions, I'm willing to answer now.
Thank you. Before I ask any, we did have follow-up from Sister Choi about her patient. Is this something that any of the 3 doctors that we've heard from so far would like to take on, can take on these types of patients that, you know, essentially have no support, terrible social situation, and old unaddressed injuries?
Which patient?
The patient we talked about at the beginning, who's laid up in a hospital with 2 broken lower extremity bones and nutritional difficulty. There's the X-ray here in the left lower corner of the screen. And more importantly, not just I'm sure you guys can handle the medical implications, but the you know, these kinds of patients that have no resources or support.
Dr. Kaplan, are you asking if
That's
they
what
can do
she was
follow-up?
asking. Let's see what you see her question, Matthias Choi. Where can I get the service for the prosthesis for the patient who had amputated leg? Well, it's not exactly the same patient. She was asking about prosthesis. I'm asking also for these patients that are out there that have old trauma and no resources. You know, where can they go without any resources?
Ok. Question Dr. Kaplan te pose, gen, tant kou ka nou te prezante ya, avec un pile lot moun peut-être qui te ka fait une chirurgie et puis qui mal fait, qui coché, qui demande réparation, est-ce que parmi panélistes, il y a une information pour ta va dire, est-ce que il y a un programme spécialisé pour ça qui a aidé avec patience, surtout ça qui a pas l'argent pour genre de service ça?
I can take part of this, and I hope Dr. Nelson could help me on that one. In terms of system of orthopedics in Haiti, there are multiple hospitals, as we mentioned, and each of them with their own mission and in their own vision. So there are multiple hospitals in Port-au-Prince and outside Port-au-Prince that can take care of those cases low cost, if not no cost, depending on the issue at hand. So my answer would be there are hospitals, I think Adventist is one of them, Lumiere and Dr. Oda will talk to this also, but there is a little fee to it depending on where you go. The university hospitals where I work, we can take all patients. There is going to be a very minimum cost to it, but they will not necessarily get proper care depending on what they have. So if, for example, somebody with a total hip will not be able to get treated or at HUH. So it's really a question of networking and knowing where to go. But there are multiple options in Port-au-Prince and outside of Port-au-Prince to that, yes.
So Dr. Woolley, before I comment on what our system is, I would be interested to know about Dr. Kaplan's patient that's by the General Hospital with that tibia fracture. How would that case be handled if he were to arrive at your hospital?
So that patient is an adult or a young patient?
He's a 50-year-old patient that was abandoned at General Hospital with a chronic tibia fracture.
Right. So that patient would be taken care of at our institution with myself, most likely, or one of my colleagues that does non-union reconstructions and complex cases. We do have access to the signed Fracture Care International program, which is an intramedullary nail program that most of the hospitals have. I know that Adventist has it. I know that Milo has it. So that patient would probably be treated with if it's an infected case, I would say a 2-stage procedure, but we would take care of it with an intramedullary nail and curing that if it's a non-union, cure non-union, and there we would be able to do that, yes, for sure.
So the question, the biggest challenge of a case like this is the economic part, I think. I know that you're an expert at doing the operation, but I'm interested to know how you would handle the economics of that situation.
So in our institution, we rely, as most state hospitals, in donations. And we do for complex cases, so not for regular cases, but for complex cases or cases that need a specific attention. Our residents are really good at getting resources to get the equipment from a partner hospital. So for example, if I would need cement to do a cement spacer for that case, I would probably call Dr. Nelson and say, do you have cement available for us to do it? And so in terms of resources, the patient that do not have money in our institution, they still get care, but there is a lot of manpower to make those cases happen. Complex cases are not that often, although more in Haiti than other places, but they're not like 10 or 15 a week. So there is always a way to treat them. It's more difficult to actually treat acute cases without the proper equipment than selective long-term cases that were neglected, and that you can plan and have an operative technique on that.
Et docteur Pierre, docteur Oli, est-ce qu'on a fait 10 en créole pour mon yo?
Oui.
C'est bien une question dans la même question. Hein?
Oui, donc pour ce genre de cas, et nous, il y a un pile l'hôpital qui a géré cas ça. C'est une question de ressources humaines et c'est une question de ressources matérielles. Si mal n'a pas gagné l'argent, ça va veut dire que nous pas prendre, au contraire, on prendre, mais temps de préparation qui prend plus de temps parce que faut que nous jouions un équipement. Et à ce moment-là, nous avons associé nous, partenaires nous, pour nous faire. Mais c'est des styles de cas que moi-même personnellement j'aime et que nous avons fait, mais c'est une question de facteur temps par rapport à côté financier. Et nous avons un programme qui est Signed Fracture Care International. I think that was a question right there. Qui s'est associé nous et de bon nous IM nails en clouage musculaire for free ou gratis. So we are part of the signed family, as they call it.
They just provide that materials, they don't provide funding for the case, those kinds of cases.
It's a give and take system. You do the IM nails, you report in their database, and they give you back the same nail and the same screws that you've asked for.
Docteur Théodore, je ne connais pas si vous même répondre à la question ça tout. Pour les gens qui n'ont pas l'argent, qui ont besoin genre de service, surtout les gens qui ont un service déjà qui est mal fait, si nous offrons un service comme ça, les gens qui ne vont pas payer.
Okay. So thank you, Dr. Nelson. For this patient, in the cases at Milo, the patient no pay for the implant. We got SAI, the Programme International, so the patient no pay for the implant. At Milo, for this patient, for example, is the patient with open fracture. We do the external fracture. At Milo, external fracture is free for this patient. But at Milo, the patient pay a little money. So for this patient, if she was an open fracture, we put the external fracture. It's free at Milo. Donc pour Milo, pour moun qui gagne fracture ouverte ça, nous avons fait fracture externe, di gratis. Moun pas payer pour la Milo. Il paye un petit bagay tout petit, c'est juste pour les contribuer. Mais il va payer un plan bien cher, il va nous faire gratuit pour lui. Donc, nous pensons que l'hôpital qui va passer à l'hôpital privé, nous n'avons pas payé un plan. Et nous avons un programme ça, qui est un programme gratuit, donc nous n'avons pas payé pour le programme ça. Donc, comme parce que c'est bien en partie ouverte, nous disons dans le cas, c'est là où nous sommes dans le cas, nous avons ça fait externe pour lui. OK? C'est un programme qui est gratuit, nous, juste payer un petit. Il contribue seulement à payer vraiment ce qu'il a payé. Donc, nous pensons que nous avons des maladies en pile, comparativement à plusieurs autres côtés. Comme on le privé, nous vraiment fait pas vraiment gratuit, mais c'est juste contribuer pour l'opération seulement. Mais un plan gratuit.
If you were able to hear the beginning, Dr. Theodore was saying that this service is free at Milo. It's probably what the patient might have to pay is minimal, but most services are not expensive as at Milo Hospital. Back to you, Dr. Kaplan.
Thank you. Hopefully that addresses another question about the materials and so forth. Hopefully that addresses it well enough. For now, there was a question for Dr. Woolley about, do you have rehabilitation services at your center?
Yeah, did you hear me? Yeah, we do not currently have a physical therapist a rehabilitation center in-house. We often refer those patients either to the rehabilitation center of OFATMA or to a different rehabilitation center if they have access to it close by. But we do not have it in-house for post-op and and from rehabilitation. I think there was another question asked to me. I don't know if you want to.
Biggest challenge as an orthopedic surgeon at the public hospital?
Yeah, so there was a question of make sure that it's very difficult. In a university hospital at La Paix, it is true that we are limited in supplies. And in the past, I would say in the past 5 years, there was very difficulties acquiring supplies and services. But now with some of our partners, we have more access to equipment. It is true also that the residents are the one that see the patient initially, but our staff over the past year has changed. We now have about 4 junior faculty who are in-house. That means that the patients are seen not only by the residents, by an attending of the day. And that also has changed. And in terms of the cases that we do, the quality and the types of cases, we've augmented our capacities. Of course, the patient will still have to pay certain things like the equipment needed. I mean, the IVs and the medication and stuff like that, but not as a package. So that's probably the only cost that they would have to do. Pretty much now.
Okay. We're going to be moving on to Dr. Oda. Dr. Nelson wants to briefly respond for his hospital on this type of patient.
Yeah, so I would, if this 50-year-old was at our hospital without any additional outside resources or any resources of his own, we would process him just like all of our other patients through our financial counseling office. And we have endowment funds that we subsidize the care of this patient with. Specifically, our donors would be contributing $500 to our hospital to take care of this patient. If a patient's able to contribute any portion of that money, then it alleviates the burden on our donors. And if any organization sent a patient like that to us, we give a 50% discount on our normal price for whatever procedure that we are needing to perform. So obviously you could send the patient without any of your sponsorship to us. We'll still look for a way to take care of them. But if there is an organization involved, we try to view it as a partnership and give 50% discount and make ends meet that way.
Et Dr. Nelson t'a répondu une question dans le cas patient que nous t'ai étudié tout à l'heure, patient qui a 50 ans, qui n'a pas l'argent pour t'avoir payé le service là, comment l'hôpital adventiste a géré ça, lui-même il dit au commencement il a géré le temps que n'importe l'autre patient qui vient et peut-être là on vient apprendre en situation gagner des services, un service spécial côté que sponsoriser genre de monde ça yo et peut-être si monde n'a pas en mesure pour payer yon partie dans l'argent ça t'a bien bon tout et si mon n'a pas capable tout peut-être petit morceau ou bien pour gratis yo chercher en façon quand même pour bay mon service là.
So as Dr. Willie said, this is a much easier situation to take care of when it's an acute fracture than in a chronic situation like this.
Et yon l'autre bagay que m'pa te du tout, si c'était un partenaire qui t'ava transféré moun sa dans l'hôpital là, et yo déjà gagné un discount spécial que yo fait, et peut-être partenaire tout lui même li ka gagné yon don spécial que yo fait pour patient depuis à l'avance, et gen cas qui ont ti jan plus facile pour t'ava gérer, c'est cas Dr. Willow ka aidé avec acute.
C'est-à-dire c'est des cas qui trauma qui sont faits. Le cas gérer plus facilement que là c'est des cas de reconstruction ou des cas négligés. J'aime te dire.
So we've started a program at our hospital called Programme Urgence Accident, and that is a special price that is about 25% of the normal price if you present within 1 week of your injury, and it's made an affordable package deal for patients with acute injuries in order to get them treated earlier with more simple treatment at a more affordable price and get them back to their jobs and their livelihood sooner.
Et comme ça tout nous gagnons un programme spécial qui est les urgences accidents côté que les moun vini bien rapide, il gagne un discount spécial que vous fait au bail service la rapide au lieu que mon ta va arrêter après plusieurs jours les que cas vient plus difficile puis ta va traiter.
All right, well, let's move on to Dr. Oda to hear about what's happening in the far south of Haiti with orthopedic care.
Et nous allons faire place à l'autre panéliste, nous, Dr. Oda, qui est trouvé dans le sud. You are on mute, Dr. Oda, ou sous silence. Allô, Dr. Oda, entendez-nous, on a fait place à vous, ou sous silence, si vous cas. Voilà.
Hello?
Oui, oui.
Hello?
Oui, vous pouvez parler, nous attendez. Vous
Entendez?
pouvez présenter peut-être tout, présenter le travail que vous avez fait, dans qui côté vous travaillez.
Donc, moi, c'est Dr. Mukwaka Oda. Moi, c'est orthopédiste dans l'hôpital Lumière Bonnefin, dans le sud. Dans la zone Cavaillon, au fond 45 minutes par rapport à Cavaillon. Et moi, ici, depuis 2016, et nous faisons en général général trauma et trauma orthopédique général. Et nous avons aussi une équipe qui sortit, nous avons une association avec South Carolina Orthopedic Association, association orthopédiste South Carolina, qui chaque 2 mois envoyait un groupe spécialiste orthopédiste pour aider nous. Et nous aussi, nous avons un programme d'échange de résidents avec l'hôpital La Paix en particulier, qui commençait depuis, ça fait environ 2 ans. Et moi, je vais commencer à dire ça en anglais tout. So my name is Dr. Mukwaka Oda. I'm an orthopedic surgeon. I work at Hospital Lumière Bonnefin since 2016. And we normally do general trauma. We also have teams from the South Carolina Orthopedic Association that come in every 2 weeks. Although during these past times, since because of COVID outbreaks and political instability, that has been kind of slowed down. And we also have residency exchange programs with orthopedic residents from South Carolina. That has also been slowed down because of the current travel ban. But we still have an exchange program with orthopedic residents from La Paix Hospital. What we normally do for our work, we do, as I said, general orthopedic trauma. We don't do spine. We do occasionally when we have hemiarthroplasty, some upper extremity, and lower extremity. And that's about all we do. I am open for any questions.
Can you say that? Did you say everything in Creole yet?
Yeah.
Yes, he did. Yes, he
Beg your
did.
pardon?
Si nous avons une question pour Dr. Oda, nous pouvons écrire dans le chat là tout. Dr. Oda, I don't think you said all the services that you had in Creole. Et dans le service que ou pas te dire le service en créole.
Désolé. Donc, moi, je fais traumatologie orthopédique, c'est-à-dire trauma en général. Si on fait un accident, nous faisons ostéosynthèse pour piffer un accident. Nous gérons quelques cas chroniques, pas tout le temps, dans la mesure du possible. Nous ne pouvons pas tellement faire cas compliqués, mais ça, nous sommes capables de nous faire. Nous faisons prothèse, pas prothèse totale, prothèse et hémiprothèse, c'est-à-dire partie supérieure fémur, nous changer, nous pas aller dans l'acétabulum, nous pas faire fracture colonne et nous pas faire prothèse totale, ni genou, ni hanche. Et nous pas faire orthoscopie non plus.
Okay.
Et occasionnellement, comme nous avons une équipe qui rentre, 2 mois, okay, sorry.
Yes, so we have a number of questions that from the panelists I mean, from the participants that the panelists can address. Someone was suggesting or questioning, wondering if there's a prepayment in small, or I guess like layaway plan or health insurance of some type that any of you have available.
Et il y a une question que nous gagnons, c'est surtout sur question l'argent. C'est un bagay pour nous connaître que le service là est disponible, et c'est un autre bagay tout pour gagner accès à lui. Alors, question qui posée, est-ce que il y a une façon pour service qui paye, il y a un moyen, soit une assurance ou bien un moyen que mon a payé par morceau pour service que les recevoir. Et ça l'ouvrir à n'importe panéliste.
Bon, on va commencer comme c'est moi qui fait. On va commencer? OK, donc, ici, là, dans l'appel, c'est l'hôpital missionnaire. Donc, nous recevons nous paiement très minimal parce que, et puis, on a bagaille et ces donations, et nous-mêmes, un pasteur sur place pour les services. Si on n'a pas qu'à payer, là, laisser le pasteur ça pour aider dans le paiement. So we also have a chaplain. This is a missionary hospital, and most of our equipment is donated. And normally the prices are really low, almost null. And for those who can't pay, we also have a chaplain available, or a pastor available to help out with the patients who can't pay. And we also receive insurance. Some people come here and ask for insurance, and we fill that out too.
I think another answer to the insurance question, they do have the, is it OFATMA, and there's ProCare from Dash Hospital. There are certain insurance programs in Haiti, either governmental or private, that are out there. It is being tried. Of course, not really a national program yet. There was another couple related questions. They wanted to know how many orthopedists are in Haiti, and do you have a professional society? And then following up about that is about visiting orthopedics that come and handle patients intermittently. Would you prefer the referrals go to the large centers for those? Does it muddy the water for those of you who are in country?
Did you ask the question, how many orthopedists are in Haiti?
Yeah, how many orthopedists in Haiti? Do they have a professional society? We did set up a Facebook group for the orthopedists, and hopefully as many as possible will be on that to collaborate, and that kind of addresses that last question. If people are connected to each other, then they can try to pull in the visiting doctor.
That's so there is a
I can't hear whoever's speaking now.
Dr. Woolley was frozen, I believe. We do have an extensive list of orthopedic specialists in the Relink Global Health database, and I would have to give credit Dr. Mazer.
So there is society in Haiti. Is the Haitian Orthopedic Society called SHOT. The last survey my partners did for paper we wrote was about 100. I'm sorry. Do you hear me now?
Now I do, yeah. Yes, right now. I just heard you then. I didn't hear the
Can
number
you
of,
hear me now?
yes. I didn't hear the number of, I heard there's a society. I didn't hear the number of orthopedists.
Maybe if possible, Dr. Willie, you could also write that in the chat if you can hear us.
That's a good idea.
Okay. So there is the Haitian Orthopedic Society.
We've been blessed with good internet so far. I guess our luck is running out.
Do you know the answer, Dr. Oda? If your connection is working better, how many orthopedists, what about the society, and the opportunities for collaboration between them and the visitors?
Well, I know that there is one, and I'm part of that association. And last time we made a count, it was it? I think it was 200, more or less 200 orthopedists. But probably the count changed since that time.
What?
And also, we have the relinkglobalhealth.org database. You can go on there and see we have a list of different orthopedics, as Barbara was saying, that Dr. Mazur had provided us. And that was over 100. So if Dr. Oda said that over 200, then.
And we have more work to do.
I didn't say over 100. I had around 200.
Around 200.
There's a slight difference.
That just means we need to work harder. That's okay.
And several residency programs, so there'll be more coming.
Question, c'était combien orthopédistes qui gagnent à travers Haïti et est-ce que gagne une association d'orthopédistes en Haïti? Le docteur Ouli a commencé à répondre, nous te comprenons que gagne une association, mais nous pas gagne temps fin prendre toute information. Cependant, docteur Oda lui-même, il te dit gagne à peu près 200 orthopédistes dans le pays et nous-mêmes tout nous te dit dans Relink Global Health, dans la base de données que nous gagnons, nous connaissons que gagne plus qu'une centaine que nous listons, alors nous avons toujours visité ce site ça pour plus d'informations.
We've had some amazing questions come in. I thank you to everybody for your active participation. We are coming up on the end of our time. Happy to stay on longer if people are able, but we do know that some people will have to hop off. I know we are missing some of the questions, so I apologize in advance. We will get them answered. You can email me or Dr. Kaplan. I can put my email in here just in case you don't have it, but Ted, do you want to ask just the last few questions? Because there's so many good ones. I don't think we've ever had this many good questions. I think it's great.
Et nous dit merci à tout le monde. Nous connaissons que l'heure a avancé sur nous. Si il y a des gens qui t'a obligé de déplacer, nous comprenons ça, mais nous avons pile d'autres questions toujours que nous pouvons répondre. Nous avons fait tirer pour nous répondre. Et nous continuons à poser des questions. Si il y a une question que nous avons posée qui ne pas répondre, nous avons toujours répondu par email et nous avons toujours écrit Madame Barbara Campbell ou bien de Haiti Health Network, email Haiti Health Network là.
I'll ask one last question that from a panelist, from a participant about any of the doctors willing to receive consultation with general practitioners elsewhere in Haiti by way of digital transmission of radiographic images and lab work, etc.
Sure, at Adventist Hospital, we're always open to that type of thing. We get many referrals and patients who are sent with x-rays.
Anyone else?
For my part, I'm open to any referrals directly to Hôpital Lumière or to me personally, because I also work in Jacmel in the southeastern part of Haiti and in Port.
I think Dr. Woolley, I don't know if his connection might be lost. Seems like, I know that Dr. Theodore and Dr. are getting generally before the COVID problems, security problems, they were getting good interaction and opportunity for additional training from visiting doctors. I didn't know if that's available to Dr. Woolley or not. And if not, if he's interested in that or has a way to have that interaction.
Et l'autre question qui t'est posée, je t'ai demandé est-ce que panélistes ou bien notre service orthopédique qui offre, ils recevoir consultation dans l'autre médecin à travers digitalement, soit par photo ou bien par l'autre moyen. Et docteur Ouda te répond oui, que est ouvert à ça, et docteur Nelson te répond tout que oui, est ouvert à ça.
Do you hear me now?
Is that Dr. Woolley? I just heard you.
Do you hear me now?
It's a little shaky, but we hear you. Yeah, I see your note, so I guess do you have centers that have been asked? He says that they're open to it. But yeah, so I think that's to me that's should be a very primary role of the visitors, is the collaboration in many areas, including further training as well as support for these materials and all the other things that are needed in order to provide the care that these doctors are very capable of providing.
Ed, I'm going to need to sign off here. I have some other things going, but thank you very much for this opportunity, and all of you, thank you for your time and attention.
Thank you, Dr. Nelson.
And, we thank everybody for joining us today. We have further of these types of lectures as well, or conversations, as well as some didactic lectures coming in collaboration with the Haiti Medical Education Project. So, you know, every time we have these conversations, I think there's a lot of discovery that happens about things that are there. I certainly didn't know that there were 200 orthopedists. I knew there were. So, there were some, but not that many. And so that really shows that we do have the opportunity to, if we can support them, keep them able to do their job in Haiti, then we can provide the orthopedic care that's needed. And as Dr. Nelson and Dr. Woolley mentioned, it's so important, if possible, to get these things handled at early stage rather than in our initial case presentation where they just languish for years without any treatment.
Et nous dire merci à tout le monde qui a participé dans ce genre de partage d'informations. Ça est toujours très important parce que nous découvrons des bagages que peut-être nous pas connaît déjà et nous trouver plus d'informations sur disponibilité services qui gagnent à travers le pays. Et Jean-Docteur Woolley avec Dr. Nelson t'a mentionné, en pile dans cas ça il est toujours bon pour nous traiter le plus tôt possible et nous encourager communication avec collaboration entre nous toutes pour service là qui a bien baillé à travers le pays.
Yeah, thank you everybody for joining us today. And again, if we didn't get to your question, I do apologize. I know there are a lot coming through. I know I'm having trouble keeping track of all of them, but we will have a record of them. We do want to get you answered. Please email us generally info@thehaitihealthnetwork.org or my email that I put in the chat, or Dr. Kaplan's if you have it. But we were happy to get you connected as anyone who knows us knows, we're very passionate about connecting everybody together to help with efficiencies. And I learned a lot today. So I thank everybody. I thank all of our panelists for sharing, and everybody have a wonderful weekend.
Et merci encore une fois à tout le monde qui t'a participé. Merci à panélistes et questions yo te en pile. J'en nous dis si il y a question pas te répondre, nous qu'à toujours contacter nous et n'a voué un email de suivi à tout le monde qui t'a participé dans séminaire dans webinaire là et nous encourager nous continuer à participer avec nous.
Bye bye everybody.
Bon week-end. Bye bye à tout le monde.
It was an honor. Merci beaucoup.
Thank you everybody.